Now, it's no surprise then that with all of these health problems and medical difficulties, people with ADHD might well show a reduced life expectancy, that is, be exposed to a risk for earlier mortality. We had suggestive evidence of this even as far back as 20 years ago in follow-up studies of children across their entire lives that showed that you could predict their likelihood of early death by all causes from one factor in childhood, the personality trait of conscientiousness that I mentioned earlier. The lower the level of conscientiousness in childhood, the greater the likelihood of experiencing earlier mortality, shortening one's life expectancy by as much as 7 years if children were in the bottom 25% of the population in that personality trait. Now, we know that ADHD is associated with very low conscientiousness. Indeed, people with ADHD are in the bottom 5% to 7% of the population in that trait. And so one could guess or hypothesize just from this alone that people with ADHD would have an even lower life expectancy than that found in the study by Friedman mentioned above. Now, recent studies have also found that people with ADHD are more likely to miss appointments in the healthcare and psychiatric systems in their country. Indeed, they are twice as likely to skip appointments they may have scheduled with their doctors, psychiatrists, and other mental health professionals. And we know that people who do this carry an 8 times greater likelihood of dying earlier than others by all causes. And I think that's because people who fail to routinely keep appointments with doctors are probably very low in that personality trait of conscientiousness, and therefore are much more likely to have ADHD. Some studies have begun to show that people with ADHD are much more likely to die at an early age due to various activities. Some of these studies, done within the last 10 to 20 years, show that if you have more disruptive or externalizing behavior in childhood, you have a nearly 2 times greater likelihood of death by age 46. Now, that doesn't just include ADHD in that problem, but also conduct problems, defiant behavior, and so on. So it's not specific to ADHD. And a study recently done by Lee and colleagues that tracked nurses over a period of 34 years found that people who failed to engage in the 5 health maintenance activities you see below were much more likely to die at a younger age. Indeed, people who smoked, who did not exercise, who had higher body mass indexes, who had excess alcohol intake and poor diet, these individuals were likely to have a reduced life expectancy of at least 12 to 14 years. Now, we can extrapolate that or generalize it to ADHD because, as I've already pointed out, people with ADHD are much more likely to engage in those risky health-related activities, such as smoking. Lately, we have accumulated direct evidence of greater mortality risk. A follow-up study of ADHD children in New York City that tracked them until age 41 found that 3 times more of them had died by midlife than was the case in the control group. Studies done also in upstate New York at Syracuse University found that during any 4-year period of follow-up, an adult diagnosed with ADHD was nearly twice as likely to have died within that 4-year period, most likely due to accidental injury and possibly suicide. This same result was evident in a study of the Danish population published by Dalsgaard and colleagues about 6 years ago. They found that children with ADHD were nearly twice as likely to die before 10 years of age, mainly due to accidental injury. But adults with ADHD were more than 4 times likely to die by midlife, again as a result of both injury and suicide, as well as other difficulties. So, overall, people with ADHD have a much, much higher risk of death in childhood or adulthood, mainly from accidents, but also suicide and possibly homicide. Another study of the Swedish population found exactly the same kind of risks. So I won't go into the details here, but you can see the evidence at the bottom of this slide. And the evidence of early death continues to accumulate, with studies done in Taiwan showing a higher risk of accidental death, suicide, and death by homicide in adults and children with ADHD, as you see here, between ages of 4 and 44. And again, a further analysis of Swedish data sets for the entire population shows again that same high risk for early mortality, as you see here. So it is a fact now that ADHD carries with it a high rate of early mortality. We can say then that ADHD is a life-threatening condition if it goes untreated through childhood and into adulthood. Now, as I've already mentioned earlier, studies of the entire human genome have found that genes for ADHD also increase risk for various medical problems. But also, we find that it is associated with earlier mortality, both in the people with ADHD and also in their parents, who are themselves more likely to have had ADHD because of the high genetic predisposition to this disorder. Now, can we actually compute the life expectancy of children diagnosed with ADHD who are followed to adulthood? This had not been done before, but about 3 to 4 years ago, I and my colleagues in Wisconsin were able to do just that. We have a longitudinal study in which these collaborators and I had followed ADHD children for 20 to 25 years until they were approximately 27 to 32 years of age. And you can see the details of my study here. I won't go into this in any detail, other than to say that by young adulthood, we split our groups into those whose ADHD had persisted to adulthood and remained diagnosable, those whose ADHD had no longer persisted. Some of them had indeed recovered and were like typical people, about 14% of them. Others continued to have high levels of symptoms and even impairment, even if it wasn't high enough to get an official diagnosis of the disorder. And then, of course, we had a control group of children who we followed for the same period of time. Now, a few years ago, we were able to obtain the formula, a calculator, for predicting life expectancy from the Goldenson Research Center at the University of Connecticut. And because I had all of the information needed to use that calculator from my longitudinal study, we were able to enter all 14 variables that were required in order to develop a more precise estimate of life expectancy. And you can see here the kinds of information that we used to predict life expectancy in our children. Things like your age, sex, height, weight, income, education, nutrition, exercise, sleep, your driving risks, whether or not you currently smoked, and your alcohol use. We had all of this information. And so we were the first study to be able to put all of this together and see just how ADHD might influence life expectancy. And here's what we found. Children diagnosed in childhood with ADHD, whether or not they had the diagnosis later in adulthood, just the diagnosis in childhood, shortened life expectancy, as you see here, considerably. Now, here what we see is the number of healthy years of life we can expect them to have left. And so at about age 27, you can see that the children with ADHD had about 9 years less of additional life that we could expect compared to typical children. They also, as you see here, had an increase in the number of unhealthy years one could expect them to have in late life. Overall, ADHD shortened the life expectancy of these children by about 8 to 9 years. Now again, I emphasize, this is just whether you were diagnosed with ADHD in childhood. It has nothing to do with whether the disorder persisted or not. And you might be asking, did treatment make any difference in this study? And the answer is no. And the reason for that is that the majority of children in this study were treated only during childhood. By adolescence, they had discontinued treatment in about 3/4 of all cases. By adulthood, more than 90% of them were no longer on medication or receiving other kinds of treatment. So what our study really says is that if you only treat ADHD in childhood, then it's going to make no difference to the long-term life course outcomes of these individuals, particularly with regard to their life expectancy. Now, let's take a look at another analysis. Here we see the results based on whether ADHD had persisted from childhood to adulthood or not. Over on the left-hand side here, we can see that children whose ADHD continued to last into adulthood and who remained diagnosable had a reduced life expectancy of 12 to 13 years compared to our typical control group. Children whose ADHD did not persist were not quite that bad off, but still had more than a 7-year reduction in their life expectancy. So even if you outgrow ADHD, or at least improve in your ADHD symptoms, even if you don't fully recover from it, ADHD has an adverse effect on life expectancy. Here we can see what I showed earlier, that ADHD, particularly if it persists, predisposes to having more years of unhealthy life in late life. And if we combine these two, healthy and unhealthy years, we see that your total life expectancy is over here on the right. If ADHD persisted to adulthood, there was about an 11 to 12-year reduction in overall lifespan. And even if your ADHD did not persist and be diagnosable, it still produced a 6 to 7-year reduction in lifespan compared to our typical control group. What about our ADHD children led to these reduced levels of life expectancy? These were the variables that were significantly worse in the children with ADHD followed to adulthood, and this is what resulted in the lower lifespans. Children with ADHD have less education, earn less income, consume more alcohol, smoke more than others, and smoke far more than even other smokers do. We also found that they were less likely to be in good health by adulthood, that they had more sleeping problems, as I've already mentioned, that they had much higher driving risks, including risks for crashes, speeding tickets, driving under the influence of alcohol and drugs, and having their licenses suspended or revoked. And we found that putting all of those factors together, what predicted why ADHD children were engaging in those problems, in those adverse health risks? And we found that it was their degree of inhibition problems, their low level of conscientiousness, that was the best predictor of their life expectancy. Now, you heard me mention earlier that this same prediction was found in the general population. High levels of impulsiveness, which means low levels of conscientiousness, is a strong predictor of human lifespan. Indeed, it explained 31% of the differences among people in our study by just that one trait. There were a few other predictors that you see here, but they accounted for much, much less variation in outcome than did that one personality trait. Let's put these findings in context to show you how impressive they are. Let's look at the things that people are concerned about when it comes to life expectancy. How much less life are you likely to have if you're overweight? It's a loss of, on average, of about 4 years. What about if you smoke? It reduces your lifespan by about 2 to 3 years. If you're smoking more than a pack of cigarettes a day, perhaps about 6 to 7 years. What if you drink alcohol to excess? It's a reduction of about 2 years in men and about a half a year in women, unless, of course, you have a substance use disorder, not just for alcohol, but for other drugs. That, of course, is quite serious and can reduce your lifespan by about 10 years. What about if you have elevated blood pressure or early signs of possible coronary heart disease? We can expect that you'll have about an average of 5 years less lifespan expected than others. Now go back and remember what we found for ADHD. We found that ADHD was associated with anywhere from about 9 to 13 years reduced life expectancy, meaning that ADHD is a far greater hazard for life expectancy than any and all of these factors put together. And yet, our societies, our governments, spend billions of dollars each year trying to get people to reduce these kinds of risk factors. And yet it spends nothing on trying to manage ADHD to improve lifespan, even though ADHD is markedly worse in predicting less life expectancy than these other factors that our governments and medical care systems are concerned about. So that should help you to understand just how serious ADHD is when it comes to one's health, wellness, and life expectancy. Now, all of the things that we found in our study that were associated with reduced life expectancy can be changed. Here they are. We can change how much education you have. We can help you change your weight, improve your nutrition. We can help you learn to exercise more, improve your sleep, engage in less risky driving, cut out smoking, reduce your alcohol consumption, and just improve your overall health and wellness. There are many ways that we can improve these factors, as well as the other health risks I talked about earlier in this presentation, such as internet addiction, accidental injuries, and so on. Indeed, there's lots of advice on the internet at many reputable websites for how to address these specific problems in children and adults, and thus lower your health risks. And I encourage you to pursue those websites if you're looking for specific recommendations of what to do to improve your child or young adults' lifespan by changing these health maintenance practices and risk factors. But one thing that you have to consider is that all of them are as a result of that single personality trait of low conscientiousness or high behavioral disinhibition. In other words, ADHD. And that means that the reason that people are engaging in these risky health-related activities, less exercise, overeating, excess use of tobacco and alcohol, and so on, is partly the result of having ADHD and especially its relationship to poor impulse control and low conscientiousness. That means that both families of ADHD children, as well as clinicians who work with these families or with these adults with ADHD, cannot just focus on improving all of these very specific first order risk factors for life expectancy and health. Instead, we must also pull back the curtain, so to speak, and identify the degree to which they have ADHD and how severe it is and how disinhibited they are. And we're going to have to treat that problem first, or we are not likely to be successful in improving these health and wellness behaviors. Studies have just begun to show that by treating ADHD with medication, we can in fact improve their likelihood of engaging in better health and wellness practices, as we see on the left side of this slide. So we can't just go about reducing weight, improving exercise, and so on. We have to see if ADHD is there, and if it is, it must be treated first in order to increase the likelihood that they will succeed in improving their health and wellness.